Hi guys, welcome back to Random Thoughts. I am the D Marie, and we are here with Lorenzo Aranda. Hello, Lorenzo. Welcome to Random Thoughts.
Hi, thanks for having me.
I hear you're a therapist. What is your title specifically? Are you a therapist or a psychiatrist?
Clinical psychologist.
Okay. What is the difference between that and like a typical therapist?
So there's basically it's based on different levels of education. So there's master's level practitioners, typically marriage and family therapists, licensed professional counselors. Then you have doctoral level, which is psychologists, and then you have people who go to med school and they become psychiatrists. The unique thing about the psychiatrists is they're technically medical doctors specializing in psychiatry or the distribution of psychiatric medications.
So I was about to say they're the ones we get our meds
Oh
from.
yeah, oh yeah.
Because
They're the pill distributors.
yes.
Yeah.
My daughter sees a therapist and she's always recommending we see the psychiatrist because she sees both to get her meds. And I'm just like, oh, can't we just dump you and go just see them? But we
Yeah.
like the therapist a lot.
Well, I mean, when you think about managed care, psychiatrists cost the insurance company a lot of money.
Yeah.
And so those appointments are typically like 15, 20 minutes. And you can't really conduct therapy in that period of
No,
time. So that's why you have
absolutely
the therapists that focus strictly on the back and forth conversation.
Okay. So do you have like a specialty?
Um, no, kind of broad based. I think in my current caseload, and there's all kinds of psychological disorders that I'm working with right now. None of the more serious ones, like psychosis and personality disorders, but most of the more common ones, anxiety, depression, trauma history, up to and including PTSD.
You know how when you work in like a retail store, you tend to see like winter clothes going out at a certain time of the year and summer clothes at certain. Do you see like certain issues at certain times of the year and like you're like, oh, I know it's about this time. I'm going to start to see more of that.
So where I'm at right now, because I'm in LA, where you pretty much just have like slight variation all year long. There's really no four seasons, for instance. Um, there's not that much of an issue, but places like the Midwest or East Coast, there might be more of a presentation in a patient of seasonal affective disorder, where people just kind of go into hibernation mode as far as their mood goes, their motivation, their energy, and sometimes it leads to a depression because the tendency with all of those circumstances in place is maybe to isolate.
You know, I've never heard anyone put it that way before. I'm like, yeah, you just described me perfectly. I've been isolating, but I try to make a big point of going, if someone says, hey, say hello and hang out. I'm like, don't keep yourself away from people.
Now, granted, there's alternative explanations other than depression for self-isolation.
Yeah.
The world is kind of a dumpster fire right now.
True.
And it causes a lot of people to just kind of take a step back and say, humanity's kind of failing me right now.
Yeah.
I need to bring back myself into a bubble of control so I can maintain my sanity.
That is also very true. I definitely shut off the news a lot for that reason because I'm just like, nope, it's too much. And anyone who wants to talk to me about the news, I'm sorry, I can't talk to you right now.
Right, yeah.
Bye.
Plausible
No.
deniability.
Exactly.
La, 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 la. Earmuffs.
So, have you seen like those commercials? I'm trying to think of who the company is, but you know those companies where they're like, "Oh, just sign up and you'll find a therapist." Are you a part of any of those? Yeah, that's it. BetterHelp.
Oh, no.
No.
I'm a psychologist within the military.
Oh, okay. So you only work with
Only service members.
service people. Okay. I like
Yeah.
it.
But before that, because I've been practicing since, well, my first practicum was in 2011, so quite a few years now, because I was through my master's program and then into my doctorate program. So quite a bit of experience working with civilian population, children, all the way up through geriatrics.
So with working with military personnel, can they fire you? Like if they're like, look, he's just not working for me, I want a different therapist, can
Oh
they
yeah.
do that?
I mean, that's kind of an ethical obligation of an establishment conducting therapy. Most it's sad that most patients don't shop around. They think like my insurance is covering this tab. I'm
I have to
assigned to
do
this
it.
therapist. I'm just stuck with them, and whether or not it's working for me. But getting into a therapeutic relationship with your provider is kind of like getting in an intimate relationship. You go on that first date, and either there's some clicking or there's no clicking going on. The chemistry's just not there, right?
Yeah.
Because you are dealing with a room with two personalities. And it's okay to say, hey, I'm really feeling committed to this therapeutic process, but I don't think it's going to really happen with our dynamic. Then you go back to your insurance provider and you say, hey, can you give me another therapist in the area? That's perfectly acceptable. Most people don't go through that.
No, I mean, I do, because I love firing people. If you just don't work with me, I'm
The empowerment.
right. I'm just like, oh no, sorry. But have you had to fire anyone? Like, you're just like, look, this patient and I are just not going to work.
Fire my patients?
Yeah, like, you're just like, no, I can't help you.
Well, I wouldn't say directly, but there's covert ways to convince them to fire me.
Okay.
If I want them to, right?
Okay.
Like, I want you to get the best treatment possible, and I just think that maybe there's a limitations to what you and I can do together. I think that you have all the tools necessary to go through the therapeutic process, but maybe there's another therapist that would align better with you. And then boom.
I think I've heard that before. So I guess I'm not always firing people, but it's okay. That's fine. I'm okay with that. Do you have, without being specific, have you ever had anything that's just like, wow, like you just heard something from someone and you went, okay.
I mean, it takes a lot to shock me at this point.
Yeah.
I have heard quite a bit, but I'd have to say, yeah. So at my last assignment, I had to evaluate people coming into the military. They're at the beginning of their careers. They're basic trainees, and there was some. I mean, some of these people, they come in from Middletown, America, and they live in farm country. No exposure to society, so there's no way for them to compare their behavior or their family trends to what broader society finds acceptable or not acceptable. And so they bring things to the table that they're disclosing, and they think it's normal. And I'm like, well, no. Right? And like you said, I'm not going to go into detail.
Yeah.
But one category that we have to draw a line, and we say, okay, you cannot be a service member, is bestiality.
Yeah, no.
And I'm just going to leave it at that.
Oh my God. Wow. Okay. All right. We will leave that there, but to not make it in the military for that is like, wow. That's a low thing on the totem pole. Like, you can't get past that. Oh, okay. So, so you said right now you're evaluating people coming in. So, has there been a time where you're working with people getting over anything or getting through anything?
Well, I mean, it's important to draw a line between what somebody's currently working through and what they worked through in the past. We don't want to stigmatize people who've had past struggles, that have conquered their demons, unlocked those closed doors of the dark secrets of their past that they refuse to acknowledge, but battled that through therapy successfully, graduated from that process, and are now moving forward with their life. We don't want to stigmatize them based on that history. We want to focus on where are they at now.
Yeah.
Right? That's for the most part, right? Certain things, like my previously mentioned statement, we can't look past. But in general, I think to an extent we all need to go through at least a certain degree of micro traumas in our lives.
Yeah.
Because that's how you build resilience.
Yeah.
Right? You can't be resilient unless you've overcome challenges.
Exactly.
Right? There's that old idea of being born with a silver spoon, right? Where you just kind of, everything served you on a silver platter through your entire life. A lot of these privileged people. If you threw them out on the street, they probably wouldn't last too long. So there's an advantage to an extent to having an adverse upbringing.
Yeah, I agree. I definitely was that person. I was so used to my parents taking care of everything that the first time I moved into an apartment, I didn't know you had to put the lights in your own name. And they kept sending me letters saying, we'll shut it off. And I'm like, I dare you to. And they finally did.
You
and
just thought it was under the landlord's name?
Exactly. It was like, no one said anything. No one told me I had to do this. And yeah, no. It wasn't until I was like 24, I said to my mom, look, you have to stop coddling me. I don't know how to be an adult.
Parents just want to know that you'll survive and endure long after they're gone. That's all they
Yeah.
want.
Well, I feel like that's why I'm constantly throwing my kid like monkey wrenches left and right. I'm just like, what would you do if this happened? Because I'm just like, I don't want you to be like me. I need you to be a real adult.
So you're not like blowing a whistle at 6 a.m. and saying, drill. You're not doing that, right?
No, I'm not that bad. I'm not that bad. But I definitely am like, hey, you're an adult. You decided not to go to college. Where's my rent money?
Yeah, absolutely.
Where is it? Where's it at?
Mm-hmm.
Yeah. So how do you feel about self-help books and people trying to work through things themselves?
I think self-help books are great. I mean, for some people who need therapy, they're a great augmentation to that therapy.
Mm-hmm.
Homework on your own, if you will, some side reading. But some people who, for one reason or another, don't make their way into a therapy office, and they're just trying to solve their problems through a self-help book, they're going to reach a cap, a limitation to being able, especially considering self-help books are not speaking directly to your problems. Mm-hmm. They're meant to be applied to a broad base population. They need to be, pretty broad in their scope. So they're not, I mean, certainly people say, I read the self-help book and boy, did it speak to me.
Yeah.
And people do have those experiences. But in order to fully customize the recovery process, you have to be able to dialogue with somebody who's understanding your personal story.
Yeah, I get it. I just have such a hard time personally, for me, working with the therapist because I'm just like, you don't know me and I don't like you giving me advice because you don't know me. But I also have issues when people tell me to do things, like even if it's something I know I should do, you told me to do it, now I'm not going to do it. So,
but see
sorry.
But those are the exact kind of dynamics that you want to be able to play out in the therapy room.
Yeah.
Because if you have those hesitations, that standoffish approach to interaction with others, that's likely coming as a consequence to all your social relationships in your life.
Yeah.
And if you can repair that lack of trust with the therapist, that can role model the trust that you might then take out of the therapy room into the broader world.
Yeah, but then you got to stop firing therapists. I literally fired my last therapist because he wanted me to work through my abandonment issues, and I went, no, sorry, that's not what I came here for.
We're staying on the surface.
Right? I was like, that's not what I came here for.
Just help me fall asleep easier.
Exactly.
Yeah.
I quit. I was like, sorry, nope, can't afford you anymore. He's like, okay, yeah, nope, sorry.
And that's the biggest thing between, I mean, in the field of psychology, there is the medical model of focusing on the symptoms, like anxiety, depression, right? There's a certain set of symptoms that go along with those diagnoses. But other therapists, their perspective is those symptoms are only presenting as a consequence to an underlying issue. That therapeutic models that are in, the standard form of therapy, what we call cognitive behavioral therapy, for instance, that are focusing strictly on the symptoms, they aren't going to be able to deep dive into that content. So take, for instance, a deep gash in your arm. It'd be equivalent as of like, I'm just going to take a rag and rub away the blood that's coming to the surface. Well, what's going to happen as soon as you remove that rag, that blood still comes to the surface. You're just repeatedly taking the rag. And that's kind of how, you're treating depression and anxiety in some cases. The underlying issue, in order to cauterize the wound closed, you have to treat maybe an unhealed relationship with your father or your mother growing up, or the tragedy of a sibling that died tragically, something like that you haven't moved past, that's causing all those symptoms to come to the surface in the first place.
You're making me think I should really give a therapist another try, but a different one, because the last one I had, he really did, like, at first I loved him because I'm originally from up north, like the Philly area, like North Jersey and Philly and South Jersey, and he was from that area too. And then as we're talking about like where we're from, I realized he may know some of my family, which is weird. So I was just like, he's like, okay, let's stop talking about this because I shouldn't know your family anyway. And then, but I liked him because it was like, okay, we're similar. We have
commonalities.
Yeah. So I was like, this is great. But every time we got on the call, because it was during COVID, so it was a lot of video chat, the first thing he'd say is, so why are we here? I'm like, what do you mean, why are we here? Stop asking me why we're here. It's a dumb question. You know why we're here. So that,
Well, that's why we say there's an art and science to this profession.
Yeah.
The art of it is being able to address what you know to be the issues, because the patient's always coming in convinced of what the problem is.
Yeah.
But if you tear away the layers of that, at the bottom is usually avoidance.
Mm.
And the avoidance is the result of some of that other, the concepts that I was just mentioning, right?
Yeah.
And so but the therapist needs to strategically work through those sessions to bring you to understand what you need to work on together.
Mm-hmm.
Because you might be what we call in the pre-contemplation phase. It's stages of readiness for approaching these things, right? So if you're in the pre-contemplation phase, then you haven't fully acknowledged what the real problem is.
Mm-hmm.
There's this denial that is set in, and it's firmly in place. And so the therapist needs to strategically weave in this idea of, well, this is what we really need to start diving into, but gently, right? It sounds like it was being force-fed to you, and that was a turnoff for you.
Yeah, it was. I mean, at first, because I came with a specific issue, I was like, I don't know how to get over this. There's been some trauma, and I know I shouldn't be blaming certain people. I'm like, I don't know how to get over this. And we talked, and I'm like, okay, I feel better. And then, he started recommending books I should read and things I should look into. And then I felt like I was just helping myself. What do we need to keep talking for?
Well, no, he had a point there.
Yeah.
I assign homework myself.
Yeah.
Why? Because even if you're seeing your therapist 1 hour out of the week,
Mm-hmm.
there's all those other hours and days in the week that you can revert back to the baseline, which is the
True.
unhelpful behaviors or thinking patterns that brought you in the first place.
Yeah.
So the homework is supposed to be a bridge to keep you engaged with the content of that hour in that time that you're not with your therapist.
Okay, I'll
So that those concepts adhere a little bit better.
So maybe I should give him a chance. I just didn't want to work on the things. It's like I get that.
So you wanted a therapist, but you didn't want to sweat.
Exactly. I'm
Well,
like, look, this is
Then you just need a best friend.
exactly. But anyway, thank you, Lorenzo, for joining us on Random Thoughts.
Of course, glad to be here.
Make sure you guys like, comment, and subscribe, and we'll talk to you later.